Hello, guys. Welcome back again to my YouTube channel. So, this is Paulo Bridge, your Pinoy nurse here in Singapore. So, for my today's content, guys, I'm going to share to all of you about what. So, the title of my content is Nursing as a Customer Service Profession. So, we will discuss about this topic, okay? So, before that, don't forget to like, share, and subscribe my channel. So, why did I choose this topic? Actually, this topic is still quite fresh to me. So, I rather share it now before I forget it. So, yeah, nursing profession is under customer service. We need to deal with our patient, and also we need to deal with our patient relatives and family members. So this is the thing that I believe that I still need to improve, and in somehow it's really difficult. It's really difficult if you're handling patient or patient relative who is what we call TLC, that requires tender loving care. Means that I'm not saying, okay, I'm not saying that they are demanding, but they are expecting a very quality service. What do you mean by quality service? When they ask something, or maybe when they request something, then you need to act promptly and you need to give it. So, reason why I'm sharing this is sometimes, like, if you are really busy, I mean, of course, you cannot say that to your patient. You cannot say that I'm busy taking care of other patient. You can never say that, I believe so. Because definitely, if that patient is what you call TLC, they will shoot complaint immediately. So, if you are dealing with other patients who are very sick and who are example, the SpO2 is saturating and the other one is the GCS drop, then you have this patient asking for Milo, asking to on the fan, and asking and feel like not comfortable with the bed, so and complaining that he hasn't eaten yet, and you realize that you forgot to attend to this patient because you're dealing with your two sicky patient. Then end up you get a complaint. So in a way that it's quite frustrating that you need to deal with this, that and you need to deal with this situation, and somehow, like, of course you want to prioritize dealing with your sick patient. I'm not saying that the request of the patient, like requesting for food and everything, is not important, but like what I said, I need to prioritize things. But you cannot explain this, you cannot reason out this to your patient also, in a way that to be honest, I keep repeating, right? But I'm quite frustrated if I experience this, because I always think that how can I improve myself? How can I deal with this kind of situation? And if, like, if example you're taking care of 10 to 11 patient, how can you multiply yourself? But also you cannot, like what I said, and I keep repeating it, you can not always reason out that they will always tell, put yourself in the, what is it? Wait, I am really searching it. Wait, what is it? Put yourself, how to put yourself in others people's shoes. Yeah, so you must always think of that when you're in nursing. I mean, if you're in a customer service profession, you need to always put yourself. But also, if in case I become a patient, I will always think that if I can observe the staff that is very busy, and I think I will be more flexible, I believe so. I'll try my best to wait and try to be more understanding. But of course, if I saw the staff, example, I'm a patient again, if I saw the staff just sitting down there and doing nothing, and if I request something and it didn't, they didn't do anything, then of course I'll be unhappy. So I believe it's a case to case basis. So this is the thing that you need to deal when you are working as a nurse. I think most of you knows this. I mean, like what I said in my previous vlog, nurse here in Singapore. I don't know if in other country, but nurse here in Singapore is it's like they doing a lot multitasking. You can be either in F&B. F&B means a food and beverage because you need to offer food. Either you can be in hotel because you need to do some you need to deal how to bed making, provide everything. So it's really a multitasking job, like you really need to make sure the experience of your patient and the patient relative in hospital is something enjoyable, something that they will remember that the service that they had received in hospital is good. But it's really difficult to do it. So, what's the purpose of this content? By the way, the purpose is something like I need to share to all of you that this is happening, and somehow it's also quite frustrating to deal with, in a way that, as me as a nurse, it's something like I find it quite you know, the feeling that you tried your best but it's not, you tried your best but it's still not enough. It's something like that. So I plead, I plead, I mean, for those patients, for those who've been patient before, or if you become a patient, hopefully in future, if you become a patient, please try to be more understanding to the nurses, maybe to the doctors and everything, about the workload that they're getting. But like, keep on repeating, I cannot always tell about this because we're in a customer service. But hopefully, this content, it reaches out to the patients or future patient, or I mean, if you experience being hospitalized, I hope it reaches that. Please try to be more understanding. And also for the nurses, of course, it's not always an excuse about we are being busy or anything, but I'm also thinking on how we can improve it. Because if you say about manpower and everything, I think manpower issue is always there. It will never be resolved. Sometimes you give more manpower, also other issue. So maybe something delegation, how to delegate things and everything, maybe is one part of the solution. And also explain properly to your patient that he or she need to wait for a while and you are prioritizing other things. I believe communication will be a best thing. You need to communicate well with your patient and patient relative. But yes, it's really difficult when you are in a fast-pacing environment. It's really difficult if like you have an emergency cases. So hopefully, I mean, somehow I'm quite relieved already that I expressed this, but it's really, I find it really difficult, and I really want to. I mean, I want to improve. I want to improve myself. One of my APN keep telling me that, is it my APN? No, one of my nursing educator recently told me that I need to reflect. So example, if some issue happens, you need to reflect to yourself on how you can improve yourself. You cannot always defend yourself like you are the correct, because sometimes, I don't know, but sometimes we still have this ego, right? So this ego thinking that we are the right one, but you need to defeat that ego and reflect on how you can improve if example you encounter this situation again. So yep, I think that's it. Thank you for watching, and bye bye.